my name is Louis Su. I'm a pediatric hematologist with a career focused on sickle cell disease. I'm in Chicago, Illinois, and have been joining the conference with half an eye on Chicago time and half an eye on Lagos time. So I was up at 5:30 o'clock in the morning this morning. What I wanted to talk about was the idea of trying to have new, maybe slightly new techniques or approaches to enlarging the sickle cell treatment team that we have in many cases in the United States and other countries, far more need for sickle cell services than we actually have sickle cell doctors or sickle cell nurses with enough expertise. And so how does one get more care? How do you get more caregivers? Is it churning people through medical school? Is it giving special degrees? Probably that's not going to work. We've tried that for a while and not many people sign up for it. So what I'd like to do is present, if possible, a few. Great, thank you. So this is a title slide. Next slide, my disclosures. Yep, next slide, please. I do have research and consulting in the field of sickle cell. I'm just going to talk about sickle cell disease in general. No off-label use, no commercial involvement. Next, please. I don't make money off of things, I just donate. So the question is, who is going to take care of the individual with sickle cell disease? Maybe it's that child right there. Are they all by themselves, or is somebody taking care of them? Well, at least you have family, would be one part. Next. Next slide, please. And we do hope to have care for a whole lifespan, that we have people who move on through childhood activities, graduation, go on into young adult roles and to workforce, family, participating in groups, having celebrations, moving on into hopefully advanced ages. Next, please. And so taking care of sickle cell probably really needs to have some acknowledgement of all those different stages and all the different portions of what's going on. So really care is only partially the medical care. Some of it is really what society does. Some of the things that the Senator Cordy was just talking about from Canada, of having recognition in the greater society of what kinds of accommodations you might need if you have sickle cell, of what kinds of laws or what kinds of other things might be needed, as well as general understanding from your friends, your neighbors, your employer, your teachers. Next, please. Next slide, please. And so you at least start with having medical people. So here's a medical person and a stethoscope. Next, please. But maybe that's not enough people. Next, please. So maybe you need really a large team, because as many people know, sickle cell disease affects all different parts of the body. It can affect skin, liver, spleen, lungs, hearts, teeth, eyes, ears, all kinds of things are affected, as well as how you function in school, how you function at work. And so all these different things, whether it be medicines, transport to different kinds of facilities, or whether it's somebody at your wedding helping you to stay hydrated, even when you're playing, when you're dancing and excited and stuff like that. If you have sickle cell disease and you're at your wedding, it would be nice to have a buddy hand you a bottle of water from time to time so you can keep hydrated and not develop pain. So it used to be that the only way to get training was with classrooms and books. And that hadn't really changed much since the days of Greeks or Romans or ancient Chinese or somebody like that. There would be somebody, old, wise person teaching in front of a whole group of people, maybe reading their books and things like that. And then things have happened. Next, please. So we now have computers, such as what we're using right now, to have distance education, to have things at our fingertips, to be able to look up at the click of a button. An entire encyclopedia, an entire library of information is at your fingertips. But how do you sort out what is the useful and what is the not so great, not so reliable, if you're trying to train somebody? If I type in sickle cell in Google and training, I think I get something like 10,000 hits. And many of those are repetitive. Some of them are out of date. So how do you sort some of that out? Next, please. So what I'd like to introduce to you is a few things that I know are very up to date and are useful as potential training things if you wanted to bring on, say, a new sickle cell doctor or a new sickle cell nurse or somebody else in the medical field. I'm going to talk later about what kinds of things to do for community health workers, community health extension workers, or peer patient advocates. But this portion with the pink backgrounds, one is that this Society of Hospital Medicine in the United States, just in the past few months, put out this set of sickle cell disease modules that are online. You can see that your cost is free. And as far as I can tell, you might need to put in your name, but you really don't have to sign up for anything permanent. You don't have to commit to anything other than you put in some time to learn about sickle cell. So these are brand new learning modules available anywhere. Next, please. Another set of modules from the American Society of Hematology, also available. I think you might need to have a connection in the American Society of Hematology to get to it. But once you do, it is free of charge. And these are ones that I actually helped to write. They're designed with the millennial audience in mind. So I am a baby boomer type of generation. My attention span is probably half an hour. I wrote these with the advice from education specialists that we need to have something where nothing stays on the screen longer than about 10 seconds, preferably 6. And that this was my target audience of 20-somethings or 30-somethings to have a fast-paced introduction, even though they're doctors, nurses, or other medical field, that we needed to have graphic rich and a video type presentation. Next, please. Another set of distance learning is available from the Centers for Disease Control. Centers for Disease Control, when they're not busy dealing with COVID, has also been putting out a lot of information about both sickle cell disease and sickle trait. Some of them are static text, basically. Some are more interesting static things like an infographic shown in the bottom right corner. 5 facts you should know about sickle cell disease in different colors. There's also things tuned for different audiences, different age ranges, for example, children, college age, adults, sports, other kind of situations. And then different sorts of articles and research are in here as well. And very, very often gets updated. I think almost every month they're putting some new things in there. Next, please. So if I was having a new sickle cell doc, a new sickle cell nurse join in, I would have them do that. But I would also have, for continuing education, something that is called tele-echo. This is something, a type of learning and a type of collaboration that has been developed at University of New Mexico in the United States, where there's a state that has very sparse population around a couple big cities. And so many of the medical specialties are concentrated in the big cities, but many of the patients are way out far away, hundreds of miles away. It takes 3 hours or more to get into the medical center. So they developed this hub and spoke approach where the hub was the academic center, the experts on, first it was hepatitis C, then it was later other things. And then they communicate with spokes to the different outlying areas, to a doctor in this town, to a doctor in that small city, to a health clinic in some other place. And every month or so we'd get together for about a half an hour of a didactic talk this is a presentation, so kind of like the wise man teaching to their classroom, except now it's online. But the other part is 30 minutes of case discussion. And so this would be really cool because you could bring from any of the hub places or the spoke places your interesting case and say, hey, what would you all do with this? What do you think of that? What are the nuances that this makes this one different? Or what are the factors in this person's particular ability to take their medicine or put up with side effects, or what they desire for their goals of combining this with treatment for their other thing, and really have a discussion, almost like peers. And the motto for the teleecho is all teach, all learn. As I mentioned, this was set up in University of New Mexico with a telephone and teleconference type of view. But as things have caught on more and more with distance learning, it is spread to, you could reach just about any place with this. So for sickle cell, this has been used for at least 4 places that I know of, that I participated in over the past half year, where different regions would have a few in a hub and many in spokes getting together to talk about sickle cell and hearing problems, to talk about sickle cell and liver problems, sickle cell and pain management acutely, sickle cell and chronic pain management, sickle cell and school accommodations and what kinds of job accommodations and things like that. And by doing so, you really have a lot of ongoing education, as well as bringing on board the new person who maybe doesn't know very much, but even the people who've been there for a while can learn from each other, because there's always some unusual thing that you haven't heard of before, or you get to share. And so besides just sharing with the hub, you also share between the spokes. And it is a very useful thing, which potentially could be projected anywhere. You know, the hub could be in one country, the spokes could be in 4 other countries. You could have a all across West Africa hub and spoke. You could have an all across all of Africa spoke, as much as you have connectivity and people with the similar time zone to be able to get together. And if you want to read more about it, called Project Echo is a reference down there from my friend Lisa Shook. Next, please. And so in applying some of this to Africa, an African setting, a project that I've been working with called Arise has done several different webinars, conferences, a series of classes using Zoom during COVID in order to maintain connections and take the education that you might have gotten by attending a conference live and put it instead online. And you can record it and replay it later. So we've had training lab technicians, training people talking about mental health, training people talking about lung problems, talking about stroke, so talking about implementation science. My colleagues in SPARCO and SADAC, Sickle in Africa project with Ambrose Wankum, Julie Makani, and many others have run similar kinds of conferences on different topics. And I'm told that many other sessions have been going on, particularly during COVID, but also in other times, so that you save on travel expense, you save on infection contagion. You just have to figure out how to get connected with the technology, as it took me 5 minutes, 10 minutes to do today. I'm sorry about that. And by the way, I'm mentioning all these different technology platforms. These are not commercial endorsements. This is just for education purposes. I don't make any money off of this. Next, please. Some of this material can be stored, and others, it could be just a once a year type of conference. So distance learning that people right now, this moment, are doing in this particular conference. Similar things happened at American Society of Hematology last December. There's the ASCAT held in London, but really, if it's virtual, you could be anywhere. Sponsored or hosted by Dr. Baba Anusa, and with much involvement from across Europe, Middle East, Africa, as well as United States. Sickle Cell Disease Association American is what I belong to the most, so I'm the chief medical officer for this, and we're planning a virtual conference for October, where we will welcome people from all different time zones interested in sickle cell. We did have to nail down what time zone we were going to aim for, so it is going to be sort of a East Coast of the United States time zone. But I think that if you can put up with staying up a little bit late to participate, we'd welcome that. Abstract deadline, by the way, is July 9th. Foundation for Sickle Cell Disease Research meeting is going on right now. I'm going to be talking to them tomorrow. Similarly, online, lots of participation globally as well as from the United States. Sickle Cell in Focus has been mostly US and Caribbean, particularly Jamaica. Global Congress in Sickle Cell, Dr. Isaac Odame, Dr. Jacques Leon have hosted this many, many times. And most recently, I think the meeting was held in India, but it's in different places as well, and then now virtual. And then sickle cell clinical research meetings held at NIH have been usually 4 straight days of clinical research presentations for like 8 hours a day. And I leave there exhilarated with a brain full of knowledge, but also a putty of mess because I've been there so long. Now they're going to do the same kind of thing, but make it virtual. So now my eyes are going to be glazed over from staring at a screen, but it's a rich learning experience, and it will be distance learning this year. So I don't think they'll have a capacity problem. Next, please. So all of those have been, next slide, ways to train up more sickle cell providers if one desires. If I could have the next slide, please. Uh-oh, got stuck. And so that you could have, instead of just a few old guys like me, wondering how long we have to wait to train more individuals with an apprenticeship approach, you can have ongoing training, ongoing education for the next generations. There is some information, a lot of information, in national guidelines. So here is a quick snapshot in font that is probably too small for anybody to read, showing that many countries have developed guidelines for sickle cell care. And the last time I looked for this was probably 6 months ago. So if something has come out since then, I apologize, I missed it. If somebody knows of a guideline for some country that came out, please send me an email, let me know. I'm trying to, is kind of like my hobby. Some people collect butterflies, I collect guidelines for sickle cell. Next, please. It gives you some idea of the regional variation and how adaptations occur. Other sets of guidelines are coming out for different foci of practice. So I'm in pediatric hematology. Most of those guidelines that I showed you for national have pretty much a pediatric hematology focus, or a genetics or a public health. So those are stars on the left. They kind of were covered in the national guidelines. But more and more, there's also things coming out just for the primary care doctor, or just for the hospital doctor. And so those are now popping out left and right. You can see the publication dates in these, 2020 and 2021. Really, really recent. Next, please. And similarly, for other disease specialists, there are new guidelines coming out. And so if you're an emergency medicine specialist, if you're a pulmonary sleep medicine, ear, nose, and throat, airway type of person, there are guidelines for that, about asthma care, about pulmonary hypertension for cardiologists, many nephrology types of guidelines. Kidney disease is a big problem. And in some places, I think we have patients who are seen more in the dialysis center or the kidney transplant center than they might be by the sickle cell team, because that has become their main problem. Obstetrics, there's horrible statistics about high maternal mortality in sickle cell disease. And so obstetricians are very interested in sickle cell. And some of their guidelines were actually some of the earlier, if you look at the date, 2011, sickle cell disease and pregnancy had management things being put out by the obstetricians prior to national guidelines coming out. Ophthalmologists, urologists, all involved. Next slide, please. And other specialists like Orthopedics, I haven't seen their guidelines yet. I'm still looking. Leg ulcers is a big problem. Stroke and cognitive impairment, neuropathies from neurology. What do you do with these? Sometimes it takes guidelines to at least lay the groundwork for those neurologists who maybe haven't seen a lot of sickle cell and need to know about it, or for those who are not neurologists and need to figure out what neurologic thing to do. Blood banking, often problems with antibodies, and so there's guidelines for that. Anesthesiology, pain medicine, what to do for the person whose pain has gotten beyond all the usual pain management treatments, or what do you do for chronic pain? For anesthesiologists, what do you do for post-operative complications? And then sometimes it's these other kinds of issues that cross over with many, many other parts of sickle cell disease. So in the rehabilitation, physical medicine category, or psychiatry, coping, depression, how you cope with pain can be also in the realm of psychiatry. Next, please. So if I was going to train more doctors, nurses, and other providers, I would use some of these material. I would also try to come alongside the existing healthcare system. This is my non-Nigerian look at what the Nigerian healthcare system looks like, coming from a couple of visits, with many different layers of healthcare, how specialized, how much intensity of tertiary, high-tech type of resources, versus how much you're really at the grassroots, how much you're in the people's neighborhoods, how much you're right next door to the patients you're taking care of. And then alongside, sort of, is also the pharmacists, the druggists, and the traditional healers. I come from a Chinese American background, and so I have my own cultural set of traditional healers who don't know much about sickle cell. They do know about blood flow and pain, and so some of the things that you might get from traditional healers might help sickle cell, acupuncture, for instance. But other things you would draw upon a Nigerian traditional healer and see if they would work to pharmacy with the community health levels in order to have things that don't conflict with each other, but at least work together. Next, please. And interprofessional collaboration is also pretty important. So, for example, we talked about teeth and dental care is important. If you have sickle cell, sometimes you can actually get teeth pain in your tooth or in your jaw without an infection, without a cavities, just because sickle cell pain can affect these places. Audiologists, there is actually a high rate of hearing loss, hearing problems, sensory neural apparently, that we don't understand very well. And is it a new approach needed for something like that? Next, please. So all of those were ways to enlarge the team for the medical team, the people with degrees after their name, with white coats, stethoscopes, etc. But what about people who don't have a health professional degree? Well, many times you can be really, really helpful without having a medical degree or professional degree. So under this umbrella term of community health worker, which is fairly prevalent in the United States as a term, there are all these different roles of possible ways that somebody can serve as a member of the healthcare team without having necessarily a degree that says MD, RN, PharmD, SW, whatever other kind of degrees you might have, and years and years of schoolwork. These are people who are probably, their credential is their common sense, they're familiar with the community, their compassion and ability to listen, and probably to help solve problems. But one of the things that I lose as I've gone through my various degrees of education is lose some of my connection to the common person's way of expressing things. I tend to go into multi-syllable words and talk about molecular biology pathways and stuff like that, where somebody who is an outreach worker, a patient navigator, can break it down into words that and concepts that people relate to, then they might relate to me. So this is where we're going to go for the next chunk. Next, please. that I, as a doctor, might have trouble figuring out, well, how come they got this appointment, it didn't show up? I don't know. They didn't call me. They didn't tell me anything. They had this appointment. They didn't show up. Literally happened to me half an hour ago. I still don't know why that patient didn't show up. But community health workers might make more better contact, might figure out, oh, you made this appointment and they were just too polite to say that this was not possible for them because that's their day that they have to take care of grandma and this is not a good time. But if you made it be 3 hours later, then they would make it. They just didn't want to tell you because they didn't want to offend you because you were there with your white coat and your tie. So those kinds of barriers community health workers can get through. But another would be sometimes patient barriers that somebody might need childcare to be able to come in. Somebody might need reminders about their medicines or about their appointments. Sometimes it's a forgetfulness thing. Sometimes it's I have too much to do kind of thing. I have this child with sickle cell disease who I need to give medicines to 2 times a day, 3 times a day. But I also have 4 other children that I'm trying to take care of, and I got to get food on the table and get them dressed and keep them clean and keep this one from fighting with the other one. And then I forget about the medicine I forgot I was supposed to give to this kid for several hours because I was tied up in the crisis of the moment. So a community health worker might be able to help with either childcare or parenting skills or some combination of that. Help teach somebody else to give the medicine to the child or help the child to start to learn it themselves. So we discussed some of this in some papers about community health workers, but how do you get a community health worker, community health extension worker to really do this? Next, please. Sometimes it takes, next slide, please, recognizing their qualities, that this is somebody who already knows the community, is not the hermit, the person who sits in isolation and never talks to anybody. This is probably a very gregarious, outgoing, hi, how you doing, knows everything that's going on in the community, but is still honest and respectful, not like gossiping behind your back after you know what's behind in the community. Be patient, be kind, be motivated to help as opposed to cut somebody down, and be caring and empathetic. This is somebody who would be a great friend for anybody, but particularly for somebody living with a chronic illness. It would be lovely to have somebody like this helping you along. Some things people bring with them, that's their personality. Some things you might be able to teach or enhance a little bit, such as more knowledge base, more advocacy skills. I know some people who are very good at advocating for themselves when they feel like they've been cheated by the cashier at the store. But if they take that same in-your-face confrontational type of style to the legislature, it might not work. Or maybe at a certain phase of legislation it works better, but not always. Or if they're talking to their doctor who they just missed their appointment or they need to change their appointment, or talking to the front desk clerk, that might not be the way to go either. So having the core skills enhanced by some training. Next, please. Next slide, please. We have found that we can bring these with several areas of usefulness for sickle cell care to help build community relationships in a network, to help educate the individual themselves with sickle cell disease, to help educate on self-management. In some cases, this is really at the time of going from child to adult, because I, as a pediatric hematologist, spent a lot of time teaching the parents how to take care of this child and loaded them up with training. They built wisdom, experience, they recognize this and that. But when this child goes from 5 to 10 years old to 15 years old to 20 years old to 25 years old, is the parent still taking care of them? Maybe, but maybe a lot of the time they want to be taking care of themselves, but they have to go through some of this training all over again because they didn't necessarily pick it up. Parents were doing it, keeping it. And then care coordination and medical home are ideas that when your care hits multiple different organ systems, it might get very complicated. So didactic training is a way to do this, but another approach that I'd like to introduce to you is role playing and scenarios. That for adult learners who are the community health extension workers, scenarios and skits and like small dramas as a way to rehearse and how you solve a problem would be a way to do training. And I'd like to show some of that to you. Next, please. If you go through the curriculum that I had ideally in my fantasy world, I would take 140 hours. It's quite a long time. That would be somebody who had never done community health worker ever before. But if you take somebody, next slide, please, who has already been a community health worker, perhaps for HIV or for asthma or for maternal child health, it takes much, much less because they just need to learn a new skill set. So with the Arise and SCORE team, I got the opportunity to go to Abuja, Kaduna, and travel around and meet some people. And we talked to different groups of stakeholders. And some are community health extension workers, traditional birth attendants. Some are primary health workers. Some are lab technicians, and some are policymakers. Can you guess which ones are the policymakers here? And can you see me there trying to blend in my outfit? Dr. Baba Anusa tried to dress me so I wouldn't stand out quite so much. Next, please. And so what we presented was, on the one hand, visual aids, so that sometimes having an adult learner, maybe a little bit more than a kid, it helps to see that there's sickle red cells, squishy red blood cells. I'm holding one up in front of me. That is a model, in contrast to sickle red blood cells that are more curved and stiff and maybe broken. And then sometimes the cells can get sticky, and so we can put adhesive tape on it and it just sticks and it doesn't move as well because it's so sticky. And these would have trouble getting through a blood vessel like this. I would put either a banana, which represents a sickle red cell, or an apple or an orange that represents a more normal red cell, and see if it'll pass through this pretend blood vessel. We can also show that sickle red blood cells are kind of curved, and the curved shape kind of corresponds also to a dried chili pepper, as shown here. And that when chili peppers break, you have the same idea as hemolysis, breaking of red cells, and the chili flakes, the seeds that come out of a chili, very exciting and inflammatory when you eat them. If you had the equivalent thing for the hemoglobin that's released from the red blood cells, it also gets an inflammation going. So that illustrates the idea that breaking red cells causes problems in the body. And so when you get the jaundice in the eyes, that also corresponds to more inflammation, and you want to try to avoid that if you can. So trying to make your eyes less jaundiced corresponds to less breakage of red cells. Next, please. Next, please. We would show some audio visuals. Oops, sorry, go back to that one. The audio visuals were the previous slide. There we go. So this one, it's a little bit older, from about 2009, but on YouTube for free from the UK Sickle Cell Society is a 3-part soap opera drama called The Family Legacy. And it shows the impact of sickle cell disease on this one family living in probably London, but from, I think, a Nigerian background. And it shows what kinds of things there would be there. I highly recommend it. It doesn't take very long. You can see all 3 parts in about 40 minutes. Next, please. So we showed that to the community health workers. Next, please. And then we presented, after some of this training, scenario topics. How would you do this? How would you solve that problem? So I'm going to show you a little bit of some photos. I couldn't quite mobilize getting the whole video together, of topic, the bullet point number 4 here, gaining support of religious and traditional leaders in this imaginary neighborhood of the community health worker. And how, when we presented this as a question, as a problem, how did they play it out as a skit, as a role play? Next, please. So in one case, they pretended to go meet with the council. And so they brought their case, And sometimes they got a good reception. You see smiling faces from the important elders or traditional leaders or the influential auntie or grandma. Next, please. Sometimes they went to the traditional healer, and this is pretending that here is this couple with a young baby, and during this role play, they very quickly got somebody's little bundle of something and pretended that's a baby and presented that to the person role playing a traditional healer, and they were being respectful and they watched to see what they would do. And then they went back to the role played grandparents, the grandparents of this new baby, who asked, so with your baby with sickle cell, what did the traditional healer say you should do? And they would tell this grandparents, role play grandparent, oh, the traditional healer said you have to do this and you have to do that. And the traditional healer would give us a bag of the right herbs and medicines, and we just had to pay them with this many chickens and that many naira. And then the grandparents then asked this young set of parents, imaginary parents, oh, okay, different wording, but what then did the clinic say? What did the primary health nurse say? Oh, the primary health nurse said that we need to give penicillin, need to give immunizations, and we need to watch out for malaria, and they'll help us with mosquito netting or something. And how much would that cost? Oh, that would be this number of naira. And so the grandparents then, in this role play, they sat back, they thought about it, and then they just said, okay, we'll go with the primary care because it's actually cheaper than the number of chickens that we'd have to come up with. Other role play was done by nurses. So here we have the supervising nurse talking to the junior nurse that they ran out of the Guthrie cards that are used for newborn screening blood samples. And you can see which one is probably the senior nurse and which one is the junior nurse. And this is problem solving. What do you do if you actually run out of the cards that you're supposed to do a test on? What now? So the nurses talk through that problem, and they talk through how this junior nurse was now responsible for ordering things in a timely fashion. And until then, she would keep on contacting the families of those that they missed so they could bring them back later when they did have a supply of the cards. Next. And they acted it out with great drama and showing emotions. Next, please. Okay, next, please. And it was very engaging. So people would be crowding close by to see what's going on instead of falling asleep at their desks. Next, please. We learned about how to solve different kinds of, presented some other kinds of problems to the policymakers, and they pretended to work it through. And it was kind of like a rehearsal for when they might be setting policy for something and molding plans to their local context. Next, please. But at last, I'm just going to show you some quick pictures showing how much people really got into the drama. They had props, they had dialogue, they had conflict, and they had great facial expressions and gestures. Next, please. This is the clerk not listening very well to the person who has a problem with sickle cell. Next, please. Next slide. And here's the person first getting a hostile reception and then a more better reception. And so we would continue with these kinds of, yes, you can see finger pointing and then everybody smiling later. So they worked out problems with these scenarios, with the community health workers teaming up with the imaginary patient, with the imaginary family. Next, please. And so in the United States, sometimes we would have scenarios like this. The newborn screen shows that this baby has sickle cell, but we cannot get the mother to bring this baby in. What do? We call the community health worker who tries to help solve that problem. And so with all of this, we try to have, oops, sorry, go back several slides. Back 3 more, reverse. These are extra slides. Okay. Reverse. So overall, what I've tried to show you was that we can expand the number of team members, here we go, to include not just a family with sickle cell, the core team, but also next forward now, that we have a larger team. So the heart gets bigger, we add more professionals, we add community health extension workers, and peer advocates, people who have walked through what it's like to be living with sickle cell, to walk through what it's like to be the mother of a child with sickle cell can be invaluable for somebody who's coming along the same path a few years later. And so introducing sickle cell disease, continuing enrichment, doing the scenarios are ways to do this kind of training, do this kind of ways to help, so that the few people who are doctors who specialize, not nurses who specialize in sickle cell, can really have a bigger team to provide optimal care. Next slide, please. For the person with sickle cell disease through their whole, with the, so this is some of the stuff I was trying to show you with guidelines and everything. Go ahead. Next slide, sorry. With the multi-layers of care around the individual, the family, the medical system, and society in general. Next, please. And really support people, next slide, through the whole lifespan of living with sickle cell disease. And that was it. Thank you. Back there. Thank you. I appreciate your attention. I don't know if there's time for any questions.
Thank you so much,
Professor
Luis. And one thing I know of, I'm from Kenya, and we're about to launch our clinical guidelines in the month of June as we celebrate the month of as we celebrate the day for World Sickle Cell Day. So it will be a pleasure to be able to talk to you about more of it later on.
Excellent. Happy to do that.